So CareShare provides facilitation. We also provide a lot of resources and information. What is happening in Watauga Avery is that they are looking very broadly. They're looking at health, income, and education. They've brought all the stakeholders together, and they are looking at working together over a long term to really make that change. Watauga Avery, because they have the plan, because they have the structure, because they have the support, but mostly because they have the vision and the willingness and the collaboration, they'll be able to make those changes.
In each Vision Council, we came up with at least 3 goals, and each one of us did have 3 goals, and we have made progress in every single one of those. In the Health Council, which is the Vision Council that I'm most active with, we came up with approaching or addressing those situations that were to do with access to care, substance abuse, and building a healthy community. So what we've done is we are working toward making the greenways and parkways better and more accessible, and we now have a newly funded federally qualified health care center, and we have a new program called Project Lazarus in our community. So we've made progress in all 3 areas since we started this a little over a year ago.
CareShare has a very broad approach to health. We see that health is health care, it is public health, it is economics, it is social networks. It's many factors go into health. The challenging part is trying to find a way to bring all those components together. Collaboration is not an easy process, so many times we are really working within the world of health, and you get sort of stuck in that world. You're just working with the same stakeholders looking at healthcare, inviting in other partners into that process. Having a structure in place, a way to do that is going to facilitate that process. So the way that the Watauga Avery group is structured gives a model to other communities for a way to do that.
If you have someone like CareShare come into the room and they are unbiased, they have a good eye, they understand the process of bringing people together, it makes a big difference. And so the communication at the very front end and the expectations are laid out so that if we go off track, then they bring us back to the center, and it helps us be more respectful, and it's so much better to have that CareShare person in the room with us.
I think the future for Watauga Avery is very good. I think that because they have come together with a very comprehensive perspective as a community, I think that they have a much better chance of really moving the needle on some of those big issues.
To have a healthy community, it takes a whole community working together. It means jobs, it means a place to live, and it means good education for your children. And that affects the whole future of a community. And working together that we've done makes me very proud.
The economic recession that we are still experiencing gives a particular challenge to every community. I think the only way that those communities can start to move that is really coming together, to really work together. And Watauga Avery, they have actually done that. And because they have the infrastructure and they now have a couple of years working together under their belt, they'll be able to continue to work together.